as we move into her range of motion, I'm just gonna kind of show what this looks like. I'm gonna have Mariah dip her chin to her chest. Good. So a lot of tension built up in the front, in the back of her, between her shoulder blades here when she did that. That's because she doesn't have the normal alignment of her cervical spine. So now I'm gonna have you extend backwards. Good. Lots of extension. Did either one of those cause you any discomfort through that area there?
Both of them.
So both of them there. So why that is because there's muscles attached to that pain point, and as she's moving her head in one direction or the other, it's causing tension on that joint and pulling it in one direction or the other, just increasing the inflammation. So now I'm gonna have you dip your ear to your shoulder on this side. Good, and ear to the shoulder on the other side. Good. And I'm just gonna have you look over your shoulder there and look over your shoulder there. Either one of those elicit pain to that?
Both of them, and even though I am the yoga instructor, I know, like, I feel that pain going from one side to the other. My range of motion is for me.
Yeah, so once she comes in and she gets adjusted, she actually notices that her yoga practice improves as well, because she's able to put herself into the normal yoga postures without feeling that pain. So I'm just gonna turn this forward for me. I'm just gonna hang on to your hips. I just want you to rotate your upper thorax there. Good. Which way's worse? So right rotation causes her pain, and that's because she's engaging that musculature right there. Okay, and then I'm gonna have you bend over, touch your toes for me. Good, and then extend all the way back. So extend backwards. I'm gonna hang on to you here.
Like, keep going.
Good, good, perfect. Any of that cause you any discomfort?
Honestly, probably the pain is more the bend forward I could start to feel.
So flexion kind of elicited some of that pain response. So now that we have a good idea of what is going on, what movements are restricted or are inhibited because she's having some discomfort here, now we're going to take you through the adjustment protocol so that you can see what that looks like in our office, and then we can have Mariah speak on some of the results she's had since she started here. Okay, so we're back with Mariah. After her treatment, we had her go through a quick range of motion, and we were both kind of blown away with the results. So we're gonna kind of do that again so that you guys can see that. So turn this way for me. I'm just gonna hang on to your hips. I want you to rotate from one side to the other for me. Awesome. Awesome.
Much better.
So she was only getting like 15 degrees of rotation on the right side. Now she's up to 45, 50 degrees. And then, so tip your head forward, much better, and then back into extension. So she already had a lot of extension, but now there's less tension when she moves her head from side to side. So then dip your ear to touch one shoulder, good, and the other side, better, and then rotation.
Right to neck?
So just look over your shoulder.
Oh, okay.
Good. So one thing that I can directly see is that these muscles aren't nearly as tight. So when she's moving through space, it's not actually grabbing and pulling up, which is what it was doing before. So this is just another testament to, not only do you get out of pain, but it's also, you get your life back, because when you're in pain, you can't move as well as you want to. You can't live out your hobbies and your loves and all those types of things. You can't pick up the kiddos and the grandkiddos off the ground because you're dealing with some type of pain or discomfort. So not only is it pain related, but then our goal is to help you get your life back post-treatment.